Thanks, Brenda. We'll check back in with you soon. Well, we're closing in on nearly 2 years since this pandemic began, and even though the fatigue has set in, we are still seeing rising COVID-19 case numbers. There are reasons to be hopeful, though. 23 ABC's Maithili Gubi joining us in central Bakersfield with more on what hospitals are seeing now and how they're coping with the surge. Maithili.
Even though COVID-19 cases are on the rise here in Kern County and across California, it might not be cause to panic too much because health experts say we could hopefully see those cases go down soon. But it is important to stay vigilant and take all the precautionary measures.
We started to come down a little bit at the end of December, and then suddenly now, in the first and second week of January, you start to see a rise.
Dr. Ghassan Jamaluddin with Adventist Health Kern County says they are seeing a rise in hospitalizations as well. Even though it's not as high as numbers during the Delta variant, he says they are feeling the impacts of this surge.
So what we are dealing with is, our health system is stressed because of the Omicron impact on our staffing, because of our increase of surge of people coming, especially after the holidays, with illnesses other than COVID.
As of Friday, the state reported that Kern County has about 248 people in the hospital with COVID-19, and that number is on the rise. This is more than double what it was 3 weeks ago. But experts do say that it doesn't appear to be as severe as previous variants.
We have people in the intensive care unit, but not as many as we used to see when we had the Delta variant.
When it comes to the numbers of infections on the public health dashboard, it does get a little tricky. The new number of cases that gets reported to the county reflect tests given on different days. So with about 2,000 new cases on the dashboard on Friday, the time range of those reported cases vary from weeks to days before the data is released. And with the number of deaths from the virus, public health says it takes time to report those numbers, so the deaths reflected are all still people who lost their lives in December. Dr. Jamaluddin says it's more than just numbers now.
The testing positive is becoming less relevant right now. We have to look at hospitalization and cases that are sick.
He says the value of testing is being able to isolate yourself so you don't spread the virus. But if you do get symptoms, you might need to seek medical attention.
The most important thing I would say, if there is shortness of breath, that's when the virus would be affecting the lung.
But there is light at the end of the tunnel.
Hoping right now that this will be getting better in the next week or so, and we will get out of it here in Kern County without having to go into crisis mode.
Now, residents aren't required to report positive health tests directly to the county, but public health does recommend they do that through the app that's available for the test or to their healthcare provider directly. Now, Kern County Public Health says they are working on a portal where residents can directly report positive tests right to the county. Live in central Bakersfield, I'm Maithili Gubi, 23 ABC, connecting you.